President Manuel Tuta got الأولى رمى تعال سوسراي بدول مراكلاي مربوغول بيلاو بيلون إبركلاي مرمسيل بيلاو President Senate Hopkins Paulus مربوغول senators Speaker Sabino Anastasio مربوغول delegates governors speakers legislators marbek other belaw ngara hutchariyin mora ang ayang ko kumilti abalo mga rekreative blur belaw kita mal al mereng asula la adiray bay rang lu elma tele la mugada al alto ta mal mereng asula Dios ni ako mara sa mga trabalwat om le urgida rabek el sil sem sulang sen lu kita ako tulule el sil se tugubet el sil se adiray bay el mo sign el proclamation ergid el kirela cancer awareness kidam dengel wase ablur bela tara doctoriano gimara meeting ra HF wase teya gotel lol sera other bela ra al sils seldo mesegel statistics ra other mura guru especially sel zoom temlameo del mom dangli en ade qabol tarrak et modi busara drongole mang moral close to telela adol sis akrar tomstria ungin information mal bol kargik ngara kensang waise bo bol ngara check up ele ngari ado ngurgi del se del lomde emertiarak traw alel mutamri adan mura gurun mun seil magatakatro banget ndi of course diri algi adram khatri do singara igel dorul diri gal gum qado masadala indiri kan wasugid man deqda sisbari example el ramdina se agotel tara gotel klolu ula gasinoma ospera do in fact to aseng ogim email basen traigel lula gasinoma omura tora to ko diregal I'm sorry I say 22% رايجاي del uk gasinoma diregal uk omur because ra akal del bu I say ogodel basen ito mo sa breast maraming cervical cancer. Maulang ari yel ungil el dong urgi dere lang al dola bel chekam kadamal mali arbek la masebo blol ngara gensang e blol cheke mal dilungil adung tegi del time by the boda saying the proclamation edo dol mol urgi tra dere ay ban me da saying the proclamation oh Triade. Pemgir. Oh. Dimo. Dia malu lam tu sese. Oh. Ma I saying first cancer awareness mande kulit radira iba im boldu se seman mosel mai garga awai awai
soblate alla president ma kamiro gul ngatnyang akmal di mo so aldi o ay salwa se cancer awareness manda umurel al sil sel mol mutra ula pangalel ako marala seguidor ko yal one or two or even many people klangara ka tulungal gargidam amla affected at yagi del ser nga ka ay for one and dak aksel kasi no man dinga ni pasyon na ngalgidel telurior so kalol nga sew mga ngigel batokal activity el makatmok el albuil man so mamaldi mo announce sa radio ako talgi pom uruning mo so is radio el al Friday di so kaldi mertiang maldi o ay sa luasyagi mga sule la buhay igel niya support di ra ngartiang olhit la sa president el ngosuma milgire la igel el maral mo activity lo mo ora Friday el molmu tra sel mo orgil September 28 ang mo niya wakathon mo niya candlelight vigil el mo malat kartirgero ko el tiram la mosmera agi dire que president el kanek tolo bangela Color State Government. Omda sa lasel sa elegi bom maano resegi daleng ang komendengela sa staff for the odalak adi mo tulang kleleng mle kongil mo so isbel mle ngar al adra Palau Cancer Society emlos dirgemlos mera. Mangel imo nga ngara Lor Hawaii Asyon Pedro mang soma mel mo o connect dal more families mo usper segi dal sil salway yalbol Tokuwet sel mo recognize, remember tir, ma family tir. And then of course all of us, el mo remember tir at kaya del sil sel el manal mo maktingul merityang emal mo mga asaul. Akapira programa gibla mo mister at radio station na T88A matobang matamtangali makadadi mo kanik druri. El borityang ako mal masauro ko.
Ma'am Sulang.
Egi olingit egi exit kami continue.
I see.
Sulang.
Ma'am Sulang. Direkal elal nombre kal wige potuloro kal no sedel uk maya tele dal joiner cell meeting rigidra seeds lo mangela FAO lo masado la sengara igel gida sedel mot magal mok increase rawa tokora food security ma tokora au mangala dara aigal yun sirigit. We will say direkal elal wige ngukani cell domos Micronesian President Summit. Nung mure eli tiablo sa 11 o'clock makwa di ma warner gitu kasi 11 o'clock mo dibus oy mang daw ko ada question rigid tia sel mlegira del morana around di because of covid kad uktimruni through zoom mang mle eli ras umura 11 o'clock elang mutra umura 11 o'clock maklo mutra umura 11 o'clock mang kadira kalogi usegi de wais adra blue lo ase kadaman ngal tanga temra sudah ada senate tira mlosa barari el kongera nominee ra Mr. Aitaron mo Minister of State kadaman mga sudah la senate of course el albal mo gingaleng dire prospera mo support ra adra blue mo dolmol mo sa support nga of course nga dir goro la mo ngara Ministry of State mo ulang artelo banget dia mokte kargida ongi mulurior tru klokora tutau emori official mungeda or sen dimla olbira dolar oro oda dire maldar albeklat mitme join ke set time elal itasil se ega dire gal after MPS meeting adok morangarad ana igel betokol project el unot mokla present remosaw madar ngabog dal algia o kire regal belur bela mlamo merek dire gal to tutre la dona sulir trigel tira ulunga seorgid especially blura Taiwan magadamo ribbon moria ribbon cutting ra ngar okla fountain youth project moria dire gal ribbon cutting ra ngar the state road paving project ngara all moria dire gal ngaklau limang road paving project ribbon cutting ma alap limang road paving project dire gal mori sel ribbon cutting ra Quabs Park ma parking lot improvement diregal project ra ukniwan hindi adel bulu adorure la gamal botong gimle ukti hospital sa ada tulak kal del bulu la mangarar ngiwal mamal gayo maria seluk ngara ngiwal state compact connecting road project madrigal ngiwal housing area road paving project ay bodo o mesra el alsid sera bulu ngiwal ya ukmal kayo kan diri kal rael el morsel dispensary so kada atsumari adra yel blue remeng said join yidra yidel el ribbon cutting game omura like yidel taklo kada itasils diri kal eli ay mloni atel el mora mo visit sel team ra project recovery Aurion Maral alnya triga ngarbelau el nome sayel skogira soldar adra mrigel nia amil tamal sera ongerul makamal sera matamal of course tigel adra regel skogi ariri drom gel skogi mangaria program adra mrigel wasen dega adril moit mangar adril monge osi gertir mangaria ngartiare langal ngaram dala aurora el amra ramdal sel mlekwarira PNQ rangaramong ngarangamalal el ngaria skogim le crusher sera forsa temela makamat el ngaria te del soldar diri mata taurior lo siga abadir ya cum kada montate kada matigertir kada mos ilmut el mora atrungal gartir ablu ramleget kada ngarse man mumala swar wase maral tirga iloy taklangar tirel tira klangar tira miloy el defender akal dogurits malam el tira adel el tira they gave their lives defending freedom marana ulang si adel kira blul michutu ngara michutu government asayid el delegation el tiger betokal adel tira mlot magala namoy taklangar til girera atelungil kangal gida kira al sira al sils el mimokle dogurits el blu gadamran maringa sulire dior hotel sel el ميدل دلويل الجد ما عبلو رامريجن أقرأ دي عارشة جيدة دريق المورشل جدا of course إن البنغلاد مقدم الأول seems like every week قديم مساعدين تقرأ كوفيد دريق الجد ما تقل مران من عسول عبلو رامريجن ملمول ملون وسير جد ما أقول قد سلب أقل مرة السيلز of course دكتور هنكاغا أوبنجد ما غفار الممس كده details را ما أكورة ردرا أجيرت تيال pandemic دي سوغل المو دوليا كده أقدر بلا مران غلطات كده غلطات التغل الأولى كده غلطات هو تنا كده مرال وسع ربق الديوسا ممكن تنطر بالواث مغلق رجيد ومسكيدا ونيلو الداسو مقدمين تيجي بالواث دي سلا قلت الكلول كان تنطر بلانو أقدر بلا سيركل تارين قرا يقال باي عمل كلو تطرل أيل التقوي مال أوكل غاري يقدر أقدر بلا عمل بالأول لو مسا يقال باي رجيد غاريا مسكو غاري ما عمل دي روت كيا كراجل شيء قال ملا البلو ويلهلم برونسولا ملا تلولجيس أكرم ناريا سيرمونيين مساعدن قال مساعدين وسا مسكو أسل اللورالن مرال ملاقلele iliaklo mru lager lorul disel sumung ora amoria agengaul malu mangaria audigel eng motmak sea o tekal tarenga umral wasa ula bela el alsil sense del waseng قد الكلويل دويسرا السلا بلو الأذر جيدا ملا فاكسينيت نسيجي ذكر تارين الدوبان من نسيل كالتالرين راول داسوم قد مطمئة واسي أجاجي دالورا بيبي رابلون دي تيجي دا بدورورين قد مسبع أخرجي ده أو مسرا رجال البلا ملبوضة بري أو سيجي سير قطرون يرال بضاعك يوجي سيجي الكالتالرين مالي مسك توتو تلل ترى ترجال هذا المنار تيجي project recovery أنكلا دكتور تات سكان أنا أقول نقاش شغال شيرين كا يمغرا بيبولا بارج اللي يمو ستوريين واسه كمية مال نغرتنا ترى أدر بلاو اللي سيجي الكالتارين أنا أقول إن إلى السيلزين سيادل نغرتيا يمرور تيالو رامه لكم سلب عقل اللي سيجي الكالتارين أنا بلوه إن سير الكالتارين لو نصير أمينسترياهل مر أدار أمينسترياهل دمرال بلغارن دين مرو دوريري المراجل كرباب السبرير ما أقول قدر سلب عقل من أخبرني لو أسين البابير عتامة كمية هذا مدير هذا رابلون دي هذا البقرير تيار هذا رورا منستريال ده منستريات بطورة أمدور تيرو سه بره غريا قبيض الأنغار تيلان ده قبيمري أيجي ده غير هذا الموسم وقلم ده سه مرينغ مرال هذا لانغوك لما sometimes إن مرينغ رايك تيار family سن تيجي ده مرال أسولي رسيجي ده الديرة كلمري أرينغ تير ما بلا أرينغ تير أبتيجان نير أدر بلاو معقولة تدري لو أكلنا رتير in harm's way دي تبتدي عندي جدا protector جدا keep us safe ما قدام رينا سولير أقوى من أكتيا أم دسر تقول سولدال يلاكلنا رتير تجا جدا السولدال الآن منقرة أبلور بيلاو معقولة تيال رقت ده قبل سيس معلومة قد سلب عقل الآن السيس ما قدام رال جدا من رينا سولير سجدا كلامريار رنغرتير ما بلتيجر رنغرتير مرة أدر بيلا والتير عبك السيلس لو ريول الوا السولدان من غرب الوا من أكتيمو كمو يجي ده باي ngwa ulan مسا غفار مع دكتور هانكوك بتباي مو أي سرية ده يجي الأوك current cases مع where we are and then by open gire lager manger seguida adedran yede 11 o'clock sula
Sulang Mr. President, malungil total morga vice marogul ministers adra media ngartia rogul adlo mes oring sirtel press conference. Akti yomu le President meringa sulela Dr. Hancock. I want to thank you, Dr. Hancock, for joining us this morning and for being with us another week. Certainly we've accomplished a lot since you arrived last week, and we continue to rely on you and Dr. Cash for your recommendations and advice for our response. So thank you first and foremost for being with us still. Akti omu'lo maskida updates sa Surangel cases. So mlani press release at tilob dara eli afternoon al-quradi umakatak Surangel details at tirigel terul positive case, material close contacts, mangel imong wal probable case il mildang ara airport. So tirigel terul positive case last week the dillo sir the isolated till 10 days tirak guidance sa CDC test out tir hindi gimnom tigiringil was sera after 10 days ang wal ko dir kang aringi a positive result trigal test tir magi mi lingit ra Dr. Thane maguk miskita ku guidance sa testing based test based criteria ku release ra other positive. So gilmutel mo test tir elang malmon lo mes tir hindi klug to telel dadangali o si tirgal adam sisi abdengir diakal se ora require au grul o si sil timing wal tamral mo diakal bukuy sa lo mes gal test result tir hindi kada malmol mildi tablong guys ral selbelaw ngel mildang airport kita mle start ra testing ra Sunday semle weekly flight magdang 120 adam larsel skogil may le test ra airport ng gidel wana wal gura mlaringa positive antigen ringi mang ngemle dimlar airport tagingun mura isolation facility mo ko lilut test ringi ra kotulurior matutar eli Egel test ra Monday matutar eli adim negative ra rogui including ra antigen wal blal release ndi akal case di say gidel kup na test ra report amle positive Dr. Thane sa elwa motelgibel kumakain masadat testing lasing ngara ul mamlaway sing tirigel 26 at close contacts at tirigel 2 positive case 22 tir amla released amla test negative ra day 10 tadi mede la tewang el almol ngara quarantine el mungir sel day 10 testing di so far tirigel rogui including tirigel 4 negative test tir so kamal at may warung udal giret saying walo otil was dimlakal yu letial dirgakal dimlakal yu letial الرقت المرتي جيد الفيرست 22 متملا ريليس تيجي عمل مولملو مسج تيجي تيوام التست تيرا دي تنر الويك من سوق من نيجاتيفين it released from quarantine اجي ديرك لوريولو من تيرا ادرا مينستيرا education ما private schools الفاينلايز السكول mitigation plan so اجي موبيترا كلوغو اجي ملي سندرينج المرا روغول سكول including a private schools متوق مسان yang ani ate eli lombas kama ma-comment sa tilgirel sel school mitigation plan. So te deadline el alsil sa Ministry of Education na compile kay gidel comments sa regel vehicle school. Yaklugo ka gimit el finalize ringi hopefully ba Friday at the earliest then sa el top da ko finalize the endorse el plan sa el isil morabela rogir ma parents to ni parents madingelo sa maldir ko close ba kreng gidela arangal kara school mong Gyolingita sebas kamama el alwik emorgo ebol sa mamel ut maklisa igit el plan ebu o ay seringin mar adrabalu. So thank you, Minister Education, for the collaboration. I think early next week we'll be able to roll that out el mar adrabalu, especially for the parents. So kung das yung adigay kita sa edel update lang direct komeng last omrus madingil wasing ladir nga niya malders tal adl yakal Belarus sera Friday Padra Friday mlanya edel dartel at over 300 el maklol adamar adolescent el mlamelara first dose ngora ngil ay sila kadamdingil sera ada dirga maral mlamelar orus last el pada kluguk dirigel mal dirga kan mo orus si ilmera kluguk ra national gym ra dolong lela 2 p.m. mo 6 p.m. and then the Pfizer dorus ngira kluguk. So dirigel remaining el 12 and older el dirga kalbel nga orus sa ilmera kluguk ra at 2 p.m. mo 6 p.m. Direct gi Oriolo Mentri dirgal private clinic doctors sama direct toktang hospital identified dirigel el giril malar sel third dose. So gi dirgal Oriolo Mentri kan parse gi the list emuse edel marusara selong edel dose el mortirgel moderately malut severely immunocompromised. And the so adel makataklir sel at time and dirga kabodo rose sel booster shot. Say so kada dirga mangira toera a CDC lo asengo ingarangin sa edel mo start the roll out ngel booster shot. So akmadingela sing adirekal laptop dra a news ra blul adel waseg the expected segid and the el time dirga kada borsay hindi gidi mo o message dirga gidi immunocompromised to start the lomasteri sa long edel dose hopefully starting next week. Dr. Thane, do you want to add anything? Maybe just explain the positive case at the airport and then why we've released from isolation.
And why we're all holding the other one. Yeah.
The initial cases and why it's past the 10 days and we're still holding it.
Okay. Yeah, thanks, Gafar. And thank you, Mr. President, Vice President, Ministers, media, and of course, all of Palau. Appreciate the opportunity to be here and collaborate with your team as you guys put in place those layers of protection to really help protect Palau from the Delta variant. So the question in regards to first the case at the airport, as you, sorry, it's always better. All right, thank you. So looking at the screening at the airport, we are working with your ministry to maximize the protection of Palau, knowing that there's a lot of Delta variant transmission outside of Palau, and how do we best identify individuals who potentially may be infected with Delta variant before they come into the country. That's one of those layers of protection. And so last weekend implemented the airport testing, which I think is quite valuable for Palau in that it allows you to get a rapid test on somebody once they arrive on island. So you're hopefully able to identify people that may, for whatever reason, be shedding virus right when they come on island. And so the fastest and easiest test to use in that setting is the antigen test, the Binax antigen test. And so we have utilized that in the Palau airport last weekend. We did identify one positive in the passengers that came in by that rapid test, that Binax antigen test. Now, as you folks may know, unfortunately, no test is 100% accurate. Sometimes people may be positive and the test says they're negative. That's one of the reasons why we have to run multiple tests and ask people to restrict their movement when they arrive in Palau. Sometimes the test will say somebody's positive who's negative, and that's why for any positive case on the antigen who is without symptoms of COVID-19, CDC recommends confirmatory testing as well as your MHHS. So once that individual was identified as positive, out of abundance of caution, move that individual into an isolation facility. So if he did turn out to be a confirmed positive, would not further expose the community, while confirmatory testing using PCR tests, which are more accurate but take a bit more time to run, were done. And with those confirmatory tests, it indicated that this individual was negative, and therefore that test at the airport was a false positive, which can happen. And he was then transferred from isolation into the standard traveler restriction of movement, and then will undergo additional testing. So as we move forward, as one of those layers of protection that you have at the airport, you may, from time to time, identify people who are positive that confirmatory testing shows that they're negative, and we may find individuals that are positive that are actually positive. In regards to the other cases, currently in Palau, folks are wanting to take a conservative approach to clearing individuals, such that the risk of transmission from a positive case into the community is quite low. CDC has recommended 10 days as a standard cutoff for people to be in isolation. As long as they've recovered, they're considered non-infectious and can be released. As these were the first two cases in Palau, there was interest in looking at utilizing the CDC test-based release criteria, which is a bit more conservative. And therefore, what that criteria requires is the individual waits 10 days and then has 2 negative tests greater than 24 hours apart before they're released. And as these were the first 2 identified cases in Palau, Ministry of Health felt that they would prefer to take the conservative approach at this time and ensure that those individuals test negative before they're released. The reason why we don't, CDC does not recommend test-based release consistently for individuals is we have found that with these sensitive PCR tests, there are individuals that can shed remnants of the dead virus for a long period after they've been infected. They are not infectious. These are sort of the broken pieces of the virus that remain there in the nose. And so it's hard for the test to distinguish if this is a viable virus, a virus that's intact and can infect people, or if it's sort of the broken pieces of the dead virus from your immune system recovering. And because some people can shed these remnants for months, CDC has moved away from requiring test-based release criteria for everyone and has instead relied on the evidence of the duration of recovery. So I think the Ministry of Health is well aware of this evidence and will continue to adjust the isolation requirements if they use the CDC duration one or the CDC test-based release based on the situation and resources at hand.
And I think one of the things, Dr. Hancock, that we're kind of familiar with is we had those first 2 cases back in June that we tested, and I think at the end we confirmed that they were historical. So maybe you can shed light a little bit.
Absolutely, Mr. President. Thank you for reminding me of that. Yeah, you guys are familiar with these folks that are persistent shedders and can test positive with a PCR because of your 2 historical cases. That other testing seemed to indicate that they were not actively infectious, but rather old infections, and those tests were picking up those remnants of the virus. So thank you for pointing that out. Well,
let's start with the question and answers.
Today, Mr. President, Vice President, Amal di Minister Setial Rogir. Question nga, President, kautel mo na meeting, adi mo na question nga. Kadam larmeng sa news out of Guam. Luwasay CDC na place ra Guam on a very high risk. Luwasay tuwalol ka ba araat man diaklo o fly mo ra Guam. Kitial ko radir ka masada Aikel mo trigal immunocompromised kada mo ay third dose 13 malubeng kada diri kami temela booster shots magera wase el always ay kita teletar el all time ya belaw diri ngarngi a flight ringi la kwamal may ngarang kora responder gil kaya kora esel teletar kwamal el alma ngi high risk ngi kiti kada ngi la temela dongot mo critical immunocompromised other belaw
So, tekma kafar. Koma Dr. Hancock answer your question.
So lang nakambes ra malungil gen. Aware kulingit ra Dr. Hancock kamulgora maskita asya singra situation ra kwame. Akum da sa tegi dia awul makadamle implement ay gid additional measures including ang testing ra airport upon arrival. Saygi del dilli raw was atokora closure, whether it's borders, malubong ng school, malubong mass gatherings sa mga rang. Tingira lultur saygi del all badabal waseng kodomes ra capacity ro hospital. Of course, saygi malmol monitor situation ra kwam at sugumuguk mangal mo kora risky, and then sa edel ko komes ra atara strategy hindi el atay may umral was segel blada kutmokla aurior mong da malmol malopa segi di hindi kita malmol malomes sa situation was sing malmuang ram. Of course al sugum perta askogi da a Sunday etiro will di positive, it's going to change our strategy hindi umdasula sa el atay may tel blada kutmoklia as edrul tuiringi for now. And then maybe Dr. Thane just perhaps shed light on the situation in Guam and what are the cases like and the hospitalization and things like that.
Victor Lee cell level 4 sa other mo sois brakwam. By recommend sa lakabe molding le ngariate le maluti rakto. That's the purpose of that. Hindi gida ukayel level sa protection gida of course kada tested tiru ra me. Tester tiral gerda border that's our countermeasure. Ding wal recommend say ali omem turakwa mengare element mutiarak. That's what they're warning people. I mean, I think that's what the level 4. Thane, Dr. Hancock, I was just trying to say that the level 4 is really a statement that says we don't want you to come to Guam because you may get it. I mean, that's what it's. There's a high probability you may get COVID in Guam, but for us, we're saying we're protecting ourselves by putting those layers of protection in, testing before they leave, testing upon arrival. That's how we protect ourselves from the threat. But please,
yeah,
and we're vaccinated, so that's
Right.
the biggest protection.
Yeah, absolutely. So yeah, I think for the level 4 travel alert notice for Guam, it is really about for people who are traveling to Guam to have an understanding that they are at risk of getting infected from COVID-19 because of the amount of transmission in Guam. But I want to point out that across the globe, Delta variant is pushing a lot of places into those areas of higher risk, including the rest of the United States. So it's not just Guam. I think in general, there's quite a bit of transmission outside of Palau. And so this is where I think the importance of really putting those layers of protection in place for Palau is key now. You have good layers in place currently, and remaining flexible and enhancing where need be as you guys, as you receive additional information. And just to reemphasize, the key layer of protection that Palau has, which is really unprecedented globally, is the level of your community that's vaccinated. That being said, I understand there are individuals who are eligible to get vaccinated in Palau who are not yet vaccinated. And I just want to reemphasize that if you are unvaccinated, please do get vaccinated. The Delta variant has made vaccination even more important than it was 3 months ago. It works remarkably well at protecting you from severe illness and having to go into the hospital and potentially deaths. So that is why we really want to reemphasize for individuals in Palau who are not vaccinated, protect yourself from Delta. It is very good at finding unvaccinated people, infecting them, and causing severe illness. And we're seeing that in Guam. Right now, the number of cases are extremely high. Guam has 80% of their eligible population vaccinated. And so you can think there's way more people in Guam who are vaccinated than those that are unvaccinated. But the numbers are about 70-30 of unvaccinated cases to vaccinated cases. So it's still primarily in the vaccinated. And when we look at folks that are hospitalized, just the other night in GMH, they had 24 folks that were hospitalized or in the hospital for COVID-19. Of those 24, only 7 were vaccinated. And of those 7, they were all older people with comorbidities. The majority of them, and so it really helps to show how the vaccine is helping protect a wide range. Even those older individuals who are hospitalized, they're not nearly as severe as they were in the last surge, according to some of our Guam colleagues who are working in the hospital. So again, just to reemphasize, one, if you're not vaccinated in Palau, go ahead. Try to get to one of the pods, get vaccinated. It's going to help protect you. It's going to help protect your family and help protect Palau. The other thing is, mentioning those vaccinated people that are in the hospital. As you may know, we've talked a lot about this additional dose for people who are immunocompromised. And so I would definitely encourage individuals who feel that they may have a weakened immune system for whatever reason to reach out to their providers and look at getting that additional dose to really boost their protection against COVID-19 with the vaccination. And then, of course, all of Palau to really think about when these boosters come out, the opportunity to really enhance your own immune system's protection against COVID-19 and the Delta variant when it does come out.
Mr. President, if I may ulitra Dr. Thane Hancock, mal share story when you mle an isil mle mitra Dr. Hancock, and he told us about the story of people who were unvaccinated who got really sick even though they were healthy. So you can share it with the media, because I thank you for sharing that story with members at NEC, because it really brought home to me why it's important that we must vaccinate with.
Sure, yeah, thank you, Vice President. And I think this story is not from my family, but a colleague's family in Guam, and she shared this with us. And I know that unfortunately in the U.S. there's many stories like this, I think from family members that have been impacted by COVID-19. But what really spurred the story was a question about can we protect ourselves from COVID-19 without the vaccine, but just by eating healthy, living healthy, sleeping, and just having our own healthy immune system. And what this story, the vaccine is the best way to really get your immune system ready to fight COVID-19. And this was a story about a family whose one of their uncles had a stroke, and they all came to the hospital to be with their family member during that difficult time. And it included individuals who were vaccinated, but there were also 2 family members that came that were not vaccinated. These 2 family members were extremely health conscious, ate healthy, were fitness folks that exercised all the time. But unfortunately, when they came, they did not know it, but at the time they were infected with COVID-19 and the Delta variant. They unfortunately spread it to the uncle who was in the hospital with a stroke, who had been vaccinated. They spread it to all the other family members as well, who were vaccinated. But as we mentioned, the Delta variant can infect vaccinated people. What they found was, unfortunately, Fortunately, the uncle did okay despite his stroke, but he survived the infection. The other family members had mild disease when they were tested, but those two health conscious individuals who were not vaccinated had very severe disease. One wound up in the ICU, and the other went into the ICU, and one unfortunately passed. So this isn't, this is just one story. There's many stories, but I think, you've heard me say over and over again that I think vaccination is really that key foundation for protecting yourself against COVID-19. But as we mentioned, nothing is 100%. So adding those extra layers. Certainly eating right and being healthy, add an extra layer. The other things that can help is, especially depending on the situation, if COVID-19 arrives, thinking about making sure you social distance, you wash your hands frequently, wear a mask. When indoors, think of ventilation. All of those are extra layers. And there's one other extra layer that I would like to bring up and share, if that's all right, that's available here. And I think people have heard me talk about it, but these are this monoclonal antibody therapy. So this is a therapy that's been authorized by FDA to really help reduce the risk that somebody who's sick with COVID-19 gets worse and goes into the hospital. It actually helps people feel better after they receive it and reduces their infectivity as well. Now, the key with this therapy is that you have to receive it. It's targeted for people that are high risk for hospitalization, so people that are older or obese or have diabetes or lung disease, and they get COVID-19. Before they get really sick, we want those individuals to come in and get this therapy. And that will reduce their risk of having to be hospitalized by 70%. So that's another layer. We would like those people to be vaccinated, but if unfortunately they are sick and they're not that sick yet, it's within the first 10 days, maybe just a mild cough, still come in, because we find that people who have severe disease tend to develop it about a week after their initial symptoms. So I want our community in Palau, or your community in Palau, to be aware that this therapy is available. It's been provided by the U.S. government to the Republic of Palau. And it's another layer of helping protect the community. And so, in fact, is that all right if I share with one of our patients received it and received the therapy and reported resolution of symptoms and improving. So it's already been utilized here in Palau at this time. So I think this is another thing. It does require the public to be aware that it's available, and collaboration with your provider to be able to access it, but yet another layer of protection for Palau.
And Dr. Hancock, while we're on that, I think one of the concerns is with the Guam flights. Of course, we have the children, 0 to 12, that are unvaccinated. So I think it's important that we share, so what's happening among those children in Guam currently, the unvaccinated population, it's spreading. How does those young ones, how are they, what's the prognosis? Or
yeah, absolutely. And so I think we get this question every time from your astute media and public. Hey, you emphasize vaccinations as being the key way to protect yourself, but we have a large proportion of our community that we care about very much, which is our kids under the age of 12 that can't be vaccinated yet. And what can we do to help protect them? One thing that we're finding, again, is that fortunately, COVID-19, even the Delta variant, does not tend to cause a large amount of severe illness in children. They can get infected, they can spread it, but again, it's rare that they have severe illness that requires hospitalization. And in fact, in Guam during the current surge, it appears that I think, right now in the hospital, there's no children in the hospital with the surge. And there was, one child, I think, that was in for a day and released. So all the hospitalizations in Guam tend to be older folks, and especially unvaccinated older folks. So it's reassuring that Guam is not seeing a high level of severe illness in their kids, despite the amount of transmission.
And then I think the other thing that we heard this morning was even in Guam, transmission between kids at school was not high. And maybe you can, yeah.
Right, yeah. So folks, I'm sure, may be aware that Guam shut down face-to-face learning and is transitioned to online learning. However, and they're doing that to try and slow transmission, but it was not due to identifying large clusters or groups of infection in the schools. Guam had implemented systems to protect the students in schools based on CDC guidance, like the Ministry of Education and MHHS are collaborating on right now for Palau. But they did not find large, a lot of transmission within schools. I think I'm not sure exactly why, what the governor's exact thinking was, but for closing schools, but certainly with that amount of transmission, I think they're really trying to reduce it. And again, that transmission tends to be driven by unvaccinated individuals, so that's why the shutdown.
And then they were saying it's coming from home is where they're getting it from.
Right. So, unfortunately, the pattern that we saw previously in the pandemic and are seeing in Guam, especially with the appropriate interventions in the schools to limit infection, is that kids don't get, usually if a child is infected, it's not from their class or from a student, although it can happen if people don't follow recommendations, but more than often it's from home, right? And so, I think as you guys can imagine, when you go home, you're with people you trust, and your guard is down and you're together. And unfortunately, if somebody unknowingly has the virus, it's much easier to spread at home than in a school.
Yeah, so, and I think that's important because, we had, when we first had this announcement, absentee rates went very high, and people are holding their kids at home because they're afraid of what might happen at school. So it's kind of like the airplanes. People say, well, airplanes are closed, transmission is maybe high there, but it's not, because they have good filtration, people wear masks, so that's not where the transmission really happens. And so I think it's much higher at karaoke bars, for example, because they're singing and other. So those are the things that we have to be more careful with. And I think that's important to help, because the response by taking your kids out of school is part of the reason why you have to close schools in Guam, because then there's nobody at school, right? So.
Right, and I think we mentioned this before, and CDC really believes that the well-being of a child is more than just being COVID-free, right? It's really about getting an education, being able to thrive and grow, and this, as we shift to sort of dealing with COVID-19 over the long term, we can't give up on educating our children. And so looking at safe ways to ensure that our kids are able to have access to education is quite important. The other thing, if I may, just to highlight one of the enhancements of the restriction of movement for people that arrive on island from Guam. Now they've been vaccinated and tested twice for COVID-19, are negative, but we are asking that those individuals, or the Ministry of Health and Human Services is asking that those individuals do not interface with children less than 12 years old. And the thought process or rationale of that is because they are your unvaccinated population in Palau. And until somebody has cleared the restriction of movement, we are asking that they try to stay away from having close interactions with those kids so that they don't inadvertently spread the infection to their kids because they are the unvaccinated. I want to highlight that that is going to be hardest for your residents that return, right? It's not like there's a lot of divers that want to hang out with with kids under 12, but I know for family members returning, that may be difficult, and ask the community, to have patience and follow this guidance to really help protect that unvaccinated population in Palau.
Thank you.
Sula, Mr. Presidente. Congratulate the Government Minister of State, Mr. Gustavo Itaro. Mr. President, namoptokol time and announced na seti al COVID-19 na anti mo mangeder ke rabe sils. Mangeder da mo kel nga rabe is a new normal. Elabela 86% of population of Elamla are fully vaccinated. Ngari agar hospital ngari I got testing. Tangani adra blue logerat na say. Ngogiwa gagidel facility na morngi ma preventive measures. Ngoingra time ang mosabe del korawal tadan created tial COVID-19. Mang mosabe del maral kel diado mo tletele kal flu. Mang mosabe del implementa gagidel el preventive measures gidamrur el adum diak tial gobidra. Nganya ko ra guidance ra CDC man uben tel government mo ngoingra time and sabe del mo announce lo ise. Rather ablo among the net nasri. Kada namo tiam lamo aflu.
Yeah, Malula Karim, Mr. Talamse, and I think this is a good question to ask Dr. Hancock. I guess the question is, when do we think, we're saying this is the new normal. When do we think we're going to reach a point when we would just treat it like the flu and go back to not having to wear a mask, just not testing? I mean, is that ever a possibility, or is this our life going forward?
Yeah, that's an excellent question, and unfortunately, I can't predict the future. No one can, but I think that is as Palau cautiously moves forward and is looking outside to see what is happening externally with the virus. I think the real goal is to build that national resilience to this virus, such that you folks are implementing interventions that allow Palauan life to move forward and move on, yet showing resilience to the infection. And potentially that could show up as having reducing the severity of the virus because of the vaccinations, and where it's no longer the threat that it was months ago. And you guys have already done that through your vaccination process. So again, just to reemphasize, for folks that haven't been vaccinated yet, do it now. Don't wait till there's community spread. It takes a while for the immune system to build up, and then for those of you with weakened immune systems, really look at getting that additional dose to help boost that protection, so that Palau can shift really into that position of resiliency or being COVID safe moving forward.
Summarize.
Thank you, Dr. Hancock. So, los adring ya tokta nga sa kada malmol maru lagagil doru del at time ngora Masa hindi kat sabail, low ay sa sengeradu barak lugo, ada ka adal sabail. Hindi wasa kada malmol matmok lagay del dor, maru lagay del doru le malmol lo mesra ay krel belaw, wasa ng rat telel ngarak. Isa yung nilu tel maklat kergi do sa tegi del orus tegi dia agire del gut makli, emla gut makli, hindi tirigel diriga lorus bel nga orus agit tel kuk mu Oltau terselong ede lorus, el mortirigel el immunocompromised, misel voltemel en direct lungil dagat makli segi dia aldul waseng kodom di deringil lo meser segi te elela klangar el mutel goramo waya klangar raw elel before el el pandemic ending way say agundaseng gira del di klagare o meseringi edi melmol mlamo truim el buil dangat tegi el state mong understand ra adra bulul was qadam la mumsaul togar adam la mumsaul rindil di masadra ko bi di madakte qabam magidi rekending at sugum qadam la survival mel al sil sense be el lutaqang le qayngiseu qawklat ke malumol matke o mesring segi de kumnas mura
Mr. Trump sang dos maklo tutula karim ang gira dolo mesaigal baby rablu ame sase material vaccinere dong wangara atretelir ambi karel atto wangara gitiam la mla isa se ko kwam trial la vaccinate taman makasay tiyan mura uguru ambi karel nga mani misen makasay agi da gira dolo mes malmol mes tial plan ding klo tutula bodo me kidam larmula yel gira del remul el protector yet ngari trial baby la diriga nga aurus ada baby rasen serie del amle madak treto seta diol ngade kalungi lo lari na paiso kalung tel tel diriga bisa doctor hen ka tel mong wasmo dise mong ara da mo understand wase problem diol and de kam dak tam la tel aurus ke doctor hen ka kaino we were meeting with the teachers and very few teachers principal said very few teachers have not gotten vaccinated. But one of the groups was ones that weren't, that were either pregnant or were breastfeeding. And maybe you could just share a little bit about that. So,
thanks, Mr. President. I think it's an important point. And, I think, I hope folks understand that throughout this pandemic, CDC, many different parts of the U.S. government, as well as our global science community is studying this virus, studying interventions to try to slow it down, and studying the vaccines and really monitoring the vaccines to ensure that they are both safe and effective. And certainly we're in a better place now than we were months ago. And one of the things that's new that CDC has recently released is, if you may recall, when the vaccines were first released, they, like all medicines, we were a bit more cautious about giving vaccines to pregnant women. Based on how these vaccines work, there wasn't, it seemed like it would be safe for pregnant women. But the initial studies were not really designed to look at giving the vaccine to pregnant women to prove its safety. But as you know, pregnancy happens, and throughout the studies, there were a number of women who were vaccinated who became pregnant. And so the initial evaluation of those women and their outcomes seemed to demonstrate that the vaccines did not impact the pregnancy in any negative way, and in fact help protect pregnant women against the severe COVID-19, because we found, like many diseases, unfortunately being pregnant puts you at higher risk of having severe COVID-19. And so there was some good early evidence that the vaccines were safe for pregnant women and actually were beneficial in helping prevent severe disease. Since then, as you know, over 170 million Americans, and that includes Palau's numbers, have been fully vaccinated. And CDC, throughout this, monitored the outcomes of pregnant women who had received the vaccine. And they found that actually the vaccine, were not able to identify any adverse increase in adverse events related to the vaccines. And again, the protection of those pregnant women from severe COVID-19 was extremely helpful. And so because of that, CDC changed the recommendations. Originally it was, if you are pregnant and you feel that you're low risk of getting COVID-19, you can discuss with your doctor and decide whether or not you want to wait till after you deliver to get vaccinated. Now CDC's recommendation is, hey, these vaccines are safe and effective for pregnant women, and if you are pregnant and not vaccinated yet, we recommend you get vaccinated to protect yourself from severe COVID-19. So that's a change. We do recommend that pregnant women get vaccinated. Again, with the Delta variant hunting down unvaccinated people, I think it makes good sense. The other thing that CDC has recommended, and really from the start, is that women who are breastfeeding do go ahead and get vaccinated. There's been no adverse events related to breastfeeding, and of course, breastfeeding is one of the best things that a mother can do for their infant, for strengthening their infant's immune system and health. But the other thing is that they found that women who are vaccinated and their immune system makes those antibodies to protect themselves against the virus, the COVID-19, is actually secreted in breast milk and given to the baby. And so it's a way that a mother can actually help protect her infant by ensuring that she's vaccinated when she's breastfeeding, and in a way, and she's helping share those antibodies against the virus with the baby to help better protect the baby from COVID-19 as well. So, new change for pregnancy and continued recommendation for breastfeeding mothers to get vaccinated.
Summarize.
Thank you, Dr. Thane. So, ala tokta nga wasing at time ng CDC abay yolingit ardiol wasing alsum dira ka morus ebem morus la mo nga radar tama okuwit el milyon el adra amerikel ultimo krevela maigal el USAPI samla nga orus tokot tira diol lati tira ka kora adverse reaction malubot ko ramal hito el atar el morungal el lorus mong bay malgol sa el time ng bayungi lardil diol el belwa orus el sugo mendirga kalunga orus direct kel nom sadra tut el wasen direct kel ngoswir ang galngal ka sugo ma aadila tut ang orus ang direct ligay del antibody wal soldara padingit el tegi del orus marula sabat ngit direct kel sel volum tutrangal ke ngoyu den morangal kam direct kel kukso kliangal kam ndia kel vol se ergal rak tam sige da kora ti kede pul lumso de la orus el mora diol mar adil lom tut
Bisiklay.
Adalutun misatra COVID el tilgibe. Malong ito presidenta matingala sa ngania sumiling arkara sa katibal time makmo askat question le kor kawe dire kal kulingit makas kay kal west question sel marabe kal minister sel kuk ngania kal mortir wala pun mereka press conference matingala sa ngania micronesian president summit el kautal me announce el basing skon moringila klugo kumal ang yawas mang akira sa ngara taregel ngara agenda el al mal kora global cooler el pomosado mi president ra micronesian country apod ngala sing ako bitatarak maklol tokoy ma dal exitra PIF tingwa ti so dal morosi was ngara sem kora klol common issue kami masada nilang makti askar semels seringi poregel restra questions
Ang why say of course ang area PIF ang area COVID hindi tara so la tertora transportation na drone legal belum magrado lisi ri skog transportation am lidiul madavo ngaray gel sia del kaya sia ornil spesi o lidiul sia do donil wasen help para geiza help para ay gal belwado mo kita may el belum bebera time o lidiul atitu ko la sige del mururo lidiul mo ngira drone legal belum lagi nasia del spesi sia focus el tiagi del al forum. Sura, dimi sa iyo.
Okay, makamam sulang edik target question kal maristra ati awan ra question janga mutul ma ministry ra mora maybe mora ka material kal mora ka far understand the lasang ani kel Pfizer niya mo expire al September 3rd dira kalak alwi de ngaring itika komitian masada sa kum screener tirgal mora tirgal immunocompromised mo malar silong ete lorus kera asi at sukum tamilaya mother night sabihin mo malara Pfizer al ubang sukum deke kang adi oital sukum ma expire September 3rd sige dawan na question kuk next question na mora kami ngay kamal kapera tol partel belum mal kakaros ng imahel hindi question na mora minister at matul girela tirgel ngara 300 madaling adal tirangatel program ra cross actor lang lak alwide setara priority ra kamiwa o siga amot elalaw ready ra pol marektel cross actra sila ilalpoila September ma question na say ngara ko ra plan sel kirite ke kabelment ang absorber tiro uyal ubang ngara ko ra plan ra ministry kiri len direct understanding im beto kar adrangot albulul direct al schedule dun mo marahil ra at sila ka table time tara question na kukmura minister agriculture and fisheries you're not getting away with no questions no kaming question ko ka era tourism lang yaktol concern era adara balul kidela kuk tokoira pickery babi asing maldiga babi diga tanem wal gora dimeral mo maringila tosi ka babin mo regal malbeto kol masang albangala makera sel albla lutol mo niya flight tel mora Taiwan ngani ako ra urior el kirela ekikidal to ko ra babi maldi last one amora minister finance tiga WIO era last week amne report to say ta mamalar sel payment tra SS ya understand ra sing SS amla authority seluto tan mura WIOA the question elang sel kuk kaniyar atal tiom ko tong lokelo si ekel kuk mlora HCF eken ngara of the swil kirel ngari atte alertir el mong ma kelo tutir mal ubang ngara tir ka pending el kirel se kital part of payment I hope ay galgari ka omlilo sa hindi across the world hindi kay kita paman misulang
Sulang elera question. So asal na ko talaga mo sensibela adal ngilo mother na kuk mamala Pfizer. So kita diol tirak la igel EUA igel emergency use authorization malubong approval ra FDA. El atta may gaya kal kangelo sa edel mix vaccines. And along the same line at tirigel memelara ong edel dose amemulara mother na li omisindra maklol other bela sa do mo umrus ang ila mother na mo mala mother na sel ko ngerul gari milgiri legal mo expire Pfizer o maral nga niya doses mo expire September 3 ese wal tele la cold chain ul mo expire hindi ka dadulo sing wal dil mate mo o expire tetele la dul top dem la thaw out mo wal gira dal spare amre at the time ul mo expire hindi tal madangin lo sa nga niya skogi umro sa rakluko kung direct ka lang niya second dose sa alwi kung ayel mo o taringil expire agila di mo itindi ka hindi akluk to talala ato dang liya sa ayel dose pe el vaccines moving forward al di dollar CDC mandabol bigik klar adrabol
gimlara cholera tutaw etulo ay sagi dolo sa ngaria supply mal di moyo rigidel kada estimate was entera bodoru sertir order en me umra lo hace seguidel dom so bodoru hace mora immunocompromised o mora September 20 why say senda kan
dia kasel immunocompromised na mo sa edel lo by cell booster mora rest priority group around the late September
so immunocompromised can start now and then booster. And then I was just sharing that in the call this morning, they said there's plenty of stock. So if people are concerned about, we just have to order and estimate how much we're going to be giving out, and there won't be a problem with the supply, right? I mean, we're getting the community to understand that there's supply, there's no shortage. So.
Malungil tutalo ko kung irsel to prep. Malungil akri me lay.
Kale baidik dilungila namuri kalmo tige presenta na momil madik wate ale kigang emurgo til close eko bomo aisra burde ada adila selcho so kadulisen se kadanga covid maral waise Mr. Talams kida gira del el help para da mo understand se te anu normal covid o banged de murgo lo banged kada gida malmol malmurula yer rogul gira del murula masabak rablum magdamal understand sel sebakring ara rablum godolong itrakal tareng ito se tolmol maltmagal kay ngasew the encourager ara tigel nga urus bon nga urus ali 170 million la dam lang uram rigen de ko lamas sing ani angidil el koram kitel talmalel o ngari tedel adam nosbel milar sel j3 sel blood clotting but other than that ngidil adal let's say ngari raktel ngari ngaranga amno vaccine and they're okay mang sedro sea the protector ablo de sea first line of defense e gida amru la rogul dorul el test monitor e mesu e continue to adjust and make sure ablo wada sel bak magdol ngite sel kaltareng I know lo seng mo toka raureng I think tarabolo runia ka farma Dr. Hancock al mutel motob dal kapsing raktura dias since 7 o'clock please encourage Adam el direct call in and ask a question lesya close to tela mo sa ko to close to tela seguida kada share information and moral information ta kaligin nga Facebook lo adi moral tuloy din moral information mo donito ase to durtura ada Ministry of Health and Human Services matigal expert gida umra lo setial al toya margolo banget diga di momdu al make sure kada salba akla mra lo spera kaltar nga rabeklat sulang namogi al morse di mura meeting makmaral trigamal dimul ding artiang for the next timas kumya update next 3 weeks activus of course Vice President ang artiang marogon ministers kita mura UN and mutel may mang way sigit aktiral malso bano di war bekla lek mengar yang lagi dirigal vaccinate kada mo apply sigit the rules so asen de kada arbiter magi kare lang di sigit gira dal malmol marke amru la gira dal marun mang sulang ma makme ay Redolmol minister tuto
Okay. Aloy se sula presidente. Halak pas ka bebir o urele ma quadritral enzert algadim an so al first tak announce mutel program ukti odor tirak lalla eng mo endra el albuil yas ko ma olbil ukti sa dal continue ni sa uk mal de moyor til fundra program di up to now gimla abro el all time amiru al millas melon mo ser trigger rogul ngara pa pandemic employment el mrula resume ertir mang omsin tira mal dimla katal resume tir mlemringa kama oltaw tira audior maurior up to date tagimna of the 374 al made al active ngara payroll in 326 agim lamrula resume tir imna start al transition til mara private sector ngani akong balil giblam sen daigal circulate ang clearer adal possibly sa ilmo sigaurior mga diar mla hire til mara construction jegal mo mas kuma detail ruriul di targi moruni ala gidele division of employment services amalas mal streamline or self process ra adra ngodal belu bal sumo mornia adami ul kora ame renew walu bangania adang ra outside al trial may egi first seldori day seldora losiga ready other velo agi practice in all time coming magi encourage ra rogul gombali may el mo gagi dalis trigel viable applicant el sibil hartil adra belaw asku mukti gal do ulelo ngat mo renew malup tahan gel adra ngodal belu sida process el gimangi dimbay sigal by askra minister finance mo ko makael ko masaw dagal to kraw do sku mani gel gidalaw do the program I endra as far as I know endra al physical year sing mo gera gera ko
solar selger lera tora babia gagi daguk ministry motmok al malasam al adresera disela malgela babil ilmu available al mura addressers al time ngarinya di 10 legalom el lenklungel ablila issue tastagar aralel at least ngarinya imol babilom el once a month mong babia mararinya suelom el 3 times a year dito asing mal mo stress ang albawi mo sa igel cook ethics ra to kora armen to sa dilom el 2 times a year sa yawan ra ngaringin el all time mong so idel expect al adi tenel ngalgela bawi imal bawi alom el average 10 to 14 asing average ang atenas so idel to ra 1 month ngaringin sa lurior el diregal expand ra bila bawi mingir permit occupy tov del mos mamal cleaner sel era nekken namru la design rabila babi se selam qatmokla mos bedel estimate rangara 450 piglets do tov al selatarra direga el effort direga la sen tangariar adra sersel ngari armil se bedel no ser tiria mo breathers mo almo toga babi son digal sal isura qasen no diaga skogim no diaga se bedel masimen el mi amle isyungel adlul mella amle stara tawang gem la mem lo statlom el egida ngariya igal borol ngartiam do spe egida wal gada modula besel tanera babil merbelaw ma egida agora ministry motmokol malasam lom doisa idisela ngalgela babil available el mora farmers mo Dios spera understanding other avluk masel al time an average centena sab edel lo tobdara al sela talvule o malasam el increaser say gaskara mora la toksora gabsangi ma radias mal sugu mangariar el momsadara togra babi am surang mutul mos modil mobla takla ngariya kariren sab il gol el mongeng mutul small idere el invitar other ngariya interested tirgo sel mera nekken melesa operational al time mal facility se main constraint ma ulum dasab edlom dois of tol babi
Sebagai bias kerana follow up pertil ang rural boran. Next question. Again, before lo sa tagal tora babi, letara concern and raise niya adal tira o individuals tira o babi. Awa say rather than ministry marurak lo babi o ela babi. Ngaraman dia kamo sa kaltrira malumang yar at already to babi kukpol breeders emol sis akartir el malgerel di to espera adal ngarat Taiwan al me breeder gal babi al umang yar olele del technology as el transferring in mora tirgal kuk private operators mo sab irel kuk breeder babi ol ngara gel ka challenge el ngarsay gitel mo mister ngila
malumil gare sel di do ase gadom el rabi gado qorom dasolo se tamal di simple el toy di sel selectringen lungil tanel mabalom el seya agot el gora godel dal el aspect telurior el al time gado gora mrungil sel di sel tobda tanera taiwan atamla selectringen mal megdo asengaya ungil tane el al time diaga laboratory rigidel sab edel mal maigal simen rababi o mes under microscopic maigang mal healthy ma dos pe maral mungil ngal babi seya sab krel wasang sab ela adel mom ela babi ding swadel moringi cell capacity rigidel mara adel wase select tane gamral select ngil tane seya dal sab edel di so of course adel mo sab el inseminate rababi sab el ngidilad di cell selection ngidel tane diaga gora mal biotel di da qaseng gidil ada sab eruli mong sea process el gimalas man murunya gimla rotate rar other livestock men dia di lorula ale langi le apa ara babi lo mwada babi te dirigan la mospenda at least Tuesday Wednesday nekken el ngarsel training of course es el facility vol dor ya siabala dirigan mumrura mla kongel mumodor livestock laboratory some motel gibel ngariya ability rigidel ngarsay gidel gora laboratory partal selectra igel mosob el nyaw ngil tanel mo produsa ngil babi sulang
Minister of Finance.
Thank you, Lei, for your question. And regarding the Cross Act, it's our intention that we are able to continue the program through at least end of December. So this is something that I'm working on planning. My understanding from discussions with OEK is that they are also interested in the same objective. So I think once the budget is passed, you will see additional support for cross-act activities through the end of this year, this calendar year. Regarding the WIOA payments from, or reimbursements from Social Security, we have received some funding from the Social Security office that's meant to reimburse people for deductions taken from their benefit payments for Social Security. We are waiting on WIOA office to verify the accuracy of those figures, and then we should be processing the payments to the beneficiaries from the Treasury. Regarding the HCF, I was told that there is an inquiry to U.S. Department of Labor regarding whether or not these payments would need to be returned. It's more complicated for HCF to return the funds than it is for Social Security. So that's where the information I have ends. So that's all I can offer you for WIOA.
Oh,
Sula Chief of Staff, Temora Minister of Finance, Dimdela one manding labs tial budget 2021, in Kikina Vessel budget House of Delegate considering. Assembly depending sell additional 20 million loan and ADB, and conditional ngam girel mo ngada passage sell tax reform bill. Diregan ngara house. Agi morensen most likely in the albol kangay a house tiagi the tax reform. Ok mo the albol kangerni ngania although the sebel ngoy gidra budget 2022 lomo October 1st mo.
We expect that we will have some savings from our expenditure controls this fiscal year. Some of that can be used to support the budget, but as you know, we only appropriated 90% of budget for next year. And the understanding is if we are unable to pass reforms like the tax reform proposal, we may have to look at some austerity measures and reduce expenditures further in FY22.
Sula Minister Uduch Temora Minister Matule Minister Malbatol Adar Foreigners Lurior Belau Amla todo Rablur Belau El time Makla demand Radlo Sig Radlo While Salgegre workforce available Matirgel Gimo spare tir Ngaraurior Assess Agimo Mesa tir Metotir Amlamora construction Mang mamlamo expensive adoru laurio rases el que espera radra Bangladesh ma al mutul baby rara ngani agora uldasul government amosebel malara radra ngodul blun me olgi setial ge jargi legdam le ultuir tirgai dala ngwagel ulko minister Victor Alastak mungere dem ge gogi del transition el moses secretary adar bela el mosebril ngaragal laurio rases rawera dido to the tirgal adarogui Lelang mali misel Claudi Mander Tir Tan Lamo Lava Dudil Morba Lamo Mring Ramama afford me Ngaria Gorol de Suela governmental Gireltian
Al sugum malungil agrim sadoy. Al sugum qad maldi focus ra addressers sel sogal clarify agrim. Sel do addressers in ter other low commercial farm adat ter maasel nganiam gegedel sirsir. Ler maasel nganiam gegedel sirsir ngarat ruldart madarngel. Itrigegi da rol mangarak lang disab elam asel afford rangil 1 day ingania 6 days el wukul tob el mamrula sirsir ter mga skum commercial farms alak alwithin mandi makasara o dea ka register del shares. Itrigelo shares alak alwithin makasar tira actually omgorola del lomel del angara livestock. I think I need to look at the data selm those shares. Makam specify ra kalimot kung commercial farm adang individual kora adalos perngil house boy.
Sa sila ministeran. kalilungil bom defend rabel gula commercial le tiragi del masel lurana igal mse igal dire lo spe el mega udotni e o spe lo mgarti rabekel sils men dior mo sel government tak mo commercial telat lungil audo de revenue so is e gamiak mo segi dia commercial tirila 200 el adel el mas tirila igi dia un magdam ngagal bela namo miring kamam o sigar adra Bangladesh el merula el agir el seselo lo spete el agir el 200 tala como gara ngo sugmam mo sebela aigal tirgal adra urel do spete tira igir mang modiak el sal tagay e mo sebam la ford e mergo aigal el masay masay samgro le tila igir ya mal niter kamam rela
Til amring la kugen rigin la gira la minister mafel mo masawad ringil. El alta mi ngani 900 el adra Bangladesh Palau. Emira la 19 ragot ngani 17 marar sometime ra el September. Omsin de trigel uka record rakamam. Omsin de trigel rogul adra Bangladesh el mlamer tial program el mo transfer. Omsin dem le house boy. Sorry igmaral right. Sorry mara construction ng cloud. Le sintal time tergam su gairul dar taklu grabuil e betoka complaints el since go raising betoka complaints el mer obis len moda gaududir moda lo magartir ma ultimo mangrak el musika urior ma gigita geru gat challenges ergama mara obis rel time makrada balance aududel ngala adma selbakle laklangaringi mutlagi del molgoringi lorior asers len sel okul sal mal mo yasu adira utmo misa moda gal sil survive seguida challenger gidam
Moise minister elangani alla el farmer el ngani atul ral el farmer el asabel di paying el $150 a month maglel bayungil mrelli agora public hearing malumen meeting el gaw mabol subamam lego appear matamiwe em helper gamam masem garat sol baikal problem le tiri lagi del 200 el mas el morgortir tiri la yaldum gadam nga gukauma adiokan hindi mamla mom kasar adal logro raikan ma alsumun sebele mo misa record gamik mo tangaral Bangladesh family farmer elat tangara construction malubet tamla transfer mo rangodal letang osisiul maintain osisiul numbers and din la change jabertin mo rangodal lurio le kador o mesek mo magarak dangoy titradra ay krebela al memang mo sabedal la for de urana gal migreal lurio do
I think mo a challenge gi de sadoya osigra adal willing el musugra dar bogi maklu e mrul la agid lurio malgoy len sel do mesa huri ping a standard of living anamral morba para adana mo expectacular do igal ma wori gi de imral mo wila igana miringi agerak mo ko willing el musugra dar bogi maklu ng rasers ngani am aser belal willing el musugra dar bogi maklu ng rasers gila dalik el uko ger gidep mo gida kada willing ngar segid el standard of living ngara mring lurior tika dere galo si gal du ule lak langar tira ngoriak lam kada gora balance ngil ndia kal mugula dollar adal mei agera ngani willing el member su muru segid lurior for that amount of money a month a year segida challenge gid ndia kal am lorim ra adal mo moriol muru raser sel dat mo gi maklu rabuil ukpol atil ngatil se der ka klisi el ngala I hope pendak kal within
the last garige sakalo gara question mo ra Minister Education Minister Jenkins you got into office last week sworn in so what has been your first order of business since you got in?
Well, there have been more than one. First of all, I wanted to thank Gofar and Dr. Hancock for including MOE personnel in the committee. It was a really strong learning experience for us. What we found, based on what we learned there, is that COVID has taught everybody a lot. And one of the things that they've taught that we've often overlooked is the importance of face-to-face contact in schools. And so the committee, we're developing what are called mitigation plans to enable us to, one, prepare and protect the children's health, and secondly, keep the schools open as long as possible. The obvious layers of protection, such as the vaccine, the face mask. We're also including in that the spacing in the classrooms, the facing of the tables, many little details. Ventilation of the rooms is another important issue. MOE has been working on another project for the past 6 months, which is a hand washing project through funding from JICA and the Japanese government. And that project is now ready to be implemented now in the central schools in Karor and Irai. Basically, what it has done is we're able outside hand washing stations all around the campuses, so students don't have to wait to go to the bathroom to wash their hands. They can do it, wash their hands getting ready for lunch after playing. And those also have included in that project the installation of over 100 hand disinfectant stations with the materials to do that. So that's one thing which has been right on top. The other, which I had planned on, but really didn't realize the mitigation plan was so far underway, is to reallocate our human resources to emphasize back getting into the school classrooms. Obviously, the interaction between teachers and students is a critical issue. We have significant numbers of teachers who have little experience and little education to enable them to teach. So what we're doing is we're working together with both the directors to take our specialists who are highly qualified and qualified not only in basic educational degrees, but also qualified in specific subject matters. And they are going to be used in the schools to work with teachers who need assistance in either general methodology, lesson planning, et cetera, or in terms of future planning. And this is all part of our professional development plan, which is everybody has understood is an absolute critical need for us. And in that, we'll have the specialists in the classrooms. Not only does that benefit the teachers, but it'll also benefit the specialists, because they will be able, for the first time, actually to see how the curriculum is delivered, what works and what doesn't work. And it'll give them a much better idea on how the assessments need to be developed to meet what curriculum has been delivered. So those have been the two main things. On the other hand, I just wanted to point out, I can't believe how the warm welcome I've had there. Everybody's been very helpful, very pleasant, and it just really makes you feel nice about being there. Once I learn all the acronyms, I'll be a lot better off. Thank you.
Thank you, Chief of Staff. Medi Waisak Mangagida, Speaker House of Delegate, and Adam Lego Lenil Girela budget. Ya House of Delegate tamla pasa budget. Elangara Senate tamla passing a first reading man. Dimle Suriara Dalbo Loading Sector Press Conference Rela. Homansula.
Lambodia Kagarmir Adra Media. Diyan. O madaktiyo ay sila si abay sa Minister of Finance ang nga meeting artit. Fakta Minister of Finance al amo mitlo bantarira at House al girela adra Senate al girela budget. Ya Minister Obi ang tidak kaldim lamray lal kukmoset al girela igel libong kating macron breaking al afternoon. Era bodo dobore ke ligaratan shobi di recognize ra Ambassador Sid ngartalo banggetang lilutal kieltal Sunday emitelo bantarira members ra diplomatic corps emitelo bantarira adra government ra era lora ra Sunday mora New York mangat moklal girela tripra president el mora UNGA ma dilungil basule doboray kel tanshobi mel alsil se en diswada lowrang ra malungil tanshobi mora teyim al adra government mga ngiya Iris ngira mangyor ra MOE Minister Jenkins, one of your staff, ma Chansi Useluku, ra Ministry of Health and Human Services, Morendingang ra Ministry of Finance, Marianne Clio Kasuma ra Health and Human Services, ma Franz Abalos ra Health and Human Services el direct malungutan siya bil mortir kadamra nga sulir al gire la ngilurerir, and we hope they enjoy the personal holiday tir sila po ngay mada dilungil basule a press conference el kita di merit yang imrokong man masula rokoy.